model, join an initiative in defense of the environment and water, buy local products and plant-based foods, use public transportation, cycling, walking, reduce consumption by reusing, repairing, and recycling, restore the relationship with nature. It is essential to recognize the ancestral knowledge of native peoples who have lived in balance with Mother Earth and practiced good living. Third, the multiple and complex crises facing humanity constitute urgent challenges for the continuity of life on the planet. Among other consequences, the socioeconomic and environmental context in Latin America and the Caribbean configures a scenario in which hunger, food insecurity, and malnutrition have increased. Well, in accordance with the above, today, Thursday, November 10, we open our virtual doors to discuss a topic of great importance in our region. To learn about the plans and priorities of Pan American Health Organization and the World Health Organization for the next 5 years. We invite you to leave your name, organization, and country in the comment box of the Facebook Live or YouTube Live chat. In the same space, you can leave your questions or send them via our email at webinarhorasconu@gmail.com. In this webinar, we will follow the following dynamics. We will start with institutional greeting, followed by Dr. Barbosa's presentation, followed by the speaker's comment, and then to the Q&A session. To access the certificate of attendance, as usual, in any of the chats or Facebook Live, YouTube Live chats, you will find a fixed link. You must fill out a brief survey and then leave your data for the issuance of the certificate, and it will be sent in the coming days to your emails. To start this important day, that the Andean Health Organization, I will give the welcome and institutional greeting on behalf of Dr. Maria del Carmen Calle, our Executive Secretary of the Andean Health Organization. Welcome to all attendees, especially our renowned speaker, Dr. Jarbas Barbosa, Director-elect of the Pan American Health Organization, PAHO, to whom we express our most sincere congratulations for the position he will take at the head of PAHO next year, and Dr. Luis Augusto Galbao, Senior Researcher of the Oswaldo Cruz Foundation, former PAHO official who will be with us today in the event. The Andean Health Organization Napoleon Agreement is an integration organization that works in favor of the health and well-being of the populations of its 6 member countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, with more than 168 million people in its scope. We thank you for the time you're going to give us today in this webinar number 150, since the horas started in May 2020. We consider it necessary and important to know firsthand the plans and priorities for the next 5 years that will govern the Pan American Health Organization, which generates much expectation in our region. The Pan American Health Organization is an international organization specialized in public health in the Americas, the American arm of the WHO, which provides technical cooperation in health to the governments and health institutions of its 35 member states and 4 associated countries. It is a strategic ally of Horas Conju, with which it has been working in a coordinated manner on common public health issues in the region for many years. It also promotes and supports the right to health for all, fosters cooperation between countries, and works collaboratively with ministries of health and other government agencies, civil society organizations, international agencies, universities, social security organizations, community groups, and other partners. It drives evidence-based decisions to improve health and promotes health as a driver of sustainable development. At the 30th Pan American Sanitary Conference held in Washington, D.C., USA, from September 26 to 30, health ministers and other delegates discussed health priority in the Americas, but they also elected Dr. Jarbas Barbosa da Silva Jr. as the new director of the Pan American Health Organization, who will begin his 5-year term on February 1st, 2023. And today, he will share with us his vision for the future of PAHO, his plans and priorities. Once again, welcome to all of you. Dr. Barbosa from Brazil received his medical degree from the Federal University of Pernambuco in Brazil. He specialized in public health and epidemiology at the National School of Public Health, Oswaldo Cruz Fiocruz Foundation in Rio de Janeiro. He has a master's degree in medical science and a doctorate in public health of the University of Campinas, Sao Paulo, Brazil. He began his professional career in public health in 1982, working for the State Health Secretariat in Pernambuco State, where he was later appointed as coordinator of the Sexually Transmitted Diseases and HIV/AIDS program. He later served as Municipal Secretary of Health in Olinda and State Secretary of Health in Pernambuco. From 1997 to 2003, Dr. Barbosa served as director of the National Epidemiology Center in Brasilia, within the Ministry of Health. He was the substantive coordinator of the National Health Surveillance Prevention and Control System. He joined PAHO in 2007 as Area Manager of Health Surveillance and Disease Management, where he was responsible for coordinating regional activities related to surveillance, prevention, and control of communicable and non-communicable diseases, veterinary public health, and health analysis and statistics. He served in this capacity until his return to Brazil in 2010. In 2011, Dr. Barbosa was appointed Secretary of Health Surveillance and later as Secretary of Science, Technology, and Strategic Supplies for the Ministry of Health in Brazil. He has been a member of the Brazilian delegation to the World Health Assembly, the WHO Executive Board, and the Pan American Health Organization Governing Board, and represented Brazil to the Executive Committee of PAHO from 2012 to 2014, where he served as Chairman of the Executive Committee from 2013 to 2014. From July 2015 to July 2018, Dr. Barbosa served as Director President of the Brazilian Health Regulation Agency, ANVISA. He was elected Deputy Director of Pan American Health Organization in 2018. Dr. Jarbas Barbosa da Silva Jr. was elected Director of the Pan American Health Organization in September of 2022 and will begin his term on February 1st, 2023. Dear Dr. Barbosa, thank you so much for accepting the invitation. The floor is yours. Go ahead, please. You need to unmute your microphone, please.
Doctor Barbosa, por favor, tiene que activar su micrófono. No lo escuchamos. Doctor Barbosa, por favor, quiere activar su micrófono. No lo estamos escuchando.
You need to unmute your microphone, please, Dr. Barbosa.
Tiene que activar. Ahí está.
Okay, buenas noches.
Ahora sí.
Escuchar ahora?
Ahora sí, doctor.
Can you hear me? Good evening. Good evening. I would like to thank for this kind invitation of the Andean Organization System, which is a very important mechanism to promote the integration of health of countries that have like 50 years of existence, and the Pan American Health Organization has 120 years. We are older than the agreement, but in any case, the effort and the well-coordinated effort of both of them is very important to guarantee that the countries of the Andean sub-region in the Americas can have from Horas Konu and from PAHO this well-coordinated effort in favor of health of the populations. I would also like to apologize because last week we had an issue with my agenda. It was fortunately it was possible to postpone this webinar that is very important for me. In a few words, I will summarize the priorities that I have, and therefore we can have more time for the discussion. During the campaign process, I discussed with the countries in the region that I would like to focus on some axes as a Pan American Health Organization director. First of all is to close the pandemic. As Marisela underlined, the pandemic is still there. We have come out of the most acute phase, then that's excellent. But there's always the chance that new variants may start again with other transmission waves.
Atención para que la vacuna,
So
mismo para
the
nuevas variantes,
vaccine for new variants is the best way to prevent. We're having some technical issues. Please stand by.
Por favor, active su micrófono nuevamente, doctor Jarbas. Su micrófono, por favor. No lo escuchamos, doctor.
Please unmute yourself, Dr.
Por favor, tiene que activar su micrófono. Creo que está ubicándose.
¿pueden escuchar ahora? Buenas noches.
Can you hear me now? Good evening.
Ahora sí, doctor. Adelante.
Déjeme salir para no tener dudas. Bueno,
Well,
estaba hablando sobre
I was talking about the need that we have to complete the pandemic control because the pandemic is still here. There's a chance of new variants, so it's very important to maintain surveillance and genomic surveillance to identify new variants, to maintain a monitoring of health services, and to achieve vaccination for the most vulnerable groups, the elderly, people who have some kind of problems with immunologic system or chronic diseases. This is very important to guarantee that with the new variants, the vaccines still have the capacity to prevent severe cases, those cases that will require to go to the hospital or death. It is also important to implement all the lessons that we've learned during the pandemic. Important lessons that we learned of the need to strengthening the response capacity in each country. The world is going to be protected if each country has the capacity for early detection, rapid response to a pandemic or an outbreak, because when we have capacities in each one of the countries, there is the possibility that we can carry out the contention activities at the proper time. If we leave that or wait a global force to intervene, we perhaps may lose the opportunity to act where there is still possible to contain the source, to make progress where each country can receive the technical support and receive financial resources to strengthen the national capacity. Second, the health systems issue that need to be more resilient health systems. During the pandemic, we saw that unfortunately the negative impacts that occur about the public health priorities because we didn't have the prevention and infection prevention and control well implemented. So many services had to stop because the transmission was strong in health personnel. We didn't have telemedicine mechanisms. We didn't have adequate triage so that the cases that need to have permanent monitoring of the patients with chronic diseases could continue with their treatment. So this was, we realized the need to have health systems with better financing, with a strong primary health care that can even develop an important role during a public health emergency. Third, I think that the pandemic also underscored the vulnerability that we have in Latin America and the Caribbean, with the need to import almost all the important health products. The countries in the region had to fight to have access to gloves, masks, PPE, ventilators, and then vaccines and medications. So it is very important to strengthen it, strategic initiatives that may strengthen the production capability in Latin America and the Caribbean, and use the two rotatory funds that we have in PAHO, the vaccine fund and the strategic fund, so the region's production can increase access of the region, countries from the region. I also believe that it is very important as a third important access that today we need to do this recovering, but better than what we were before. The idea is not to go back as how we were in 2019. We need to move forward because before the pandemic, for some significant indicators of the SDGs, many countries and many sub-regions in the Americas were not with an adequate progress in order to achieve these indicators for 2030. So I think that the PAHO had an important role, which is now more important and necessary to be the agency that mobilizes new initiatives and technologies and new strategies and can support countries to adapt those strategies to their national reality and to have a quicker overcoming of barriers and reach the populations that are being left behind, to reach the most vulnerable groups, and to do a sustained progress in order to reach those goals. I think that is very important how we look as an examples in the region. The big task that we have is how we transform projects that today are demonstrative projects with a lot of success into health policies. I will give you a couple of examples. A major problem that we have in the entire region is mortality due to non-transmissible chronic diseases. It's a preventable mortality by chronic non-transmissible diseases. Of each 100 deaths in the region, 30 could be preventable if we had some better capacity for detection and control of these diseases. Of 100 people, I mentioned hypertension because hypertension is the most important risk factor for death in adults in our region. Of 100 people with hypertension, only 50 are aware that they have hypertension, and only 25 have their hypertension under control. If we don't change that situation, we're going to continue with preventable death and avoidable death by chronic non-communicable diseases. Today, we have an initiative that is called the HAS initiative, that 23 countries in the region are participating in this initiative, but the cover is only more than 40 million people. So these are excellent demonstrative challenges, projects. The challenge is how can we adapt this to primary care, because the primary care cannot promote health and prevention, but also diagnosis and treatment of hypertension, diabetes, make the early diagnosis of some types of cancer. People will continue with these difficulties to reduce the risk and improve their own condition. I also believe that it's very important that we can help in other areas. For example, tuberculosis, or the negative impact that we had during the pandemic for HIV, with TB, with a reduction of the detection capacity of the countries for almost 2 years. That will require new strategies so we can have not only the recovery of the negative impact, but go even further. I also believe that it is important to look at the impact that we have today of climate change, in particular for some countries in the region, the impact of the extreme events of flooding, hurricanes and others, but also the drought, which is a threat for production and to treat hunger and malnutrition in rural areas and of indigenous populations. So we need to see how can we have a health sector can lead multi-sectorial agendas with other ministries, with a vision of participation of the entire government, but can also reduce this negative impact that this climate change is, we're suffering today. So I believe health is very important to have a strong action in that field. And it's also important to look at health workers in the region. There we have in many countries a need of physicians, nurses. We have physicians and nurses, but the distribution is not with equity, so the rural areas and the poorest areas have more difficulty in access. So we greet the initiative that was announced by President Biden, the America's Health Corp, but I think it is important to land that initiative, looking to strengthen the networks such as universities, medical schools, nursing schools that we have in the region, so we can reach this ambitious goal that was announced to train 500,000 health professionals in 5 years. In the virtual field of PAHO can be a factor of support, but we need to work and connect with the schools, medical schools that we have in the Caribbean, can also be important to strengthen this area. And finally, I'm also well committed to continue with the legacy of our director, Caricetin, of trying to guarantee more transparency for the organization, to have accountability and an active participation of all the member states of how we can work in a closer way with a growing participation of all the countries in the region, regardless of the size and their situation, so all the member states can participate in the most strategic discussions of our organization. Health sector has received attention that at least in the last 2 or 3 decades had never received before. With the pandemic, called the attention of the prime ministers, the presidents, and the Congress and public opinion. Now I think that this is the moment of how can we transform that attention that we received to position health as a core portion of sustainable development strategy, on the strategy to reduce the important inequalities that we still have in our region among the countries and inside each country. So I think that if we can work very closely with the countries, but also with the organization like Horas CONU, in a well-coordinated with CARICOM and the Caribbean, Mercosur, and Central America, to look for agendas that can be well coordinated so we can profit from those cooperation and integration and coordination platforms so that health issues can continue to be an important point and a priority that we can effectively translate in improving the quality of life and health in our region. Thank you very much. Thank you very much, Dr. Farba. We identified many common priorities, as you mentioned. Horas CONU, with 50 years, that's celebrating in December. It has a joint effort history with PAHO that we understand following your work that it will be strengthened. Thank you very much. You mentioned the access that we're going to be working to control the pandemic. We have lessons that we've learned and we need to implement and to recover our work in the field of the topic that we had postponed and be in a better situation than we had before the pandemic to construct resilient health systems based on a renewed primary health care. This effort is important that you've mentioned. Dr. Rosa, we reiterate our thanks and we invite you to remain in the room. In the following portion, we will have the Q&A. Before that, we'll have Luis Augusto Galvao. He's a master in public health, senior researcher of the Osvaldo Cruz Foundation, member of the Fiocruz strategy team toward the 2030 agenda, and assistant professor at the Department of International Health at Georgetown University. He organized and directed the area of sustainable development and environmental health at PAHO, Washington, where he works since 1991 to 2016. Was a member of the Environmental Health Sciences Roundtable of the U.S. National Academy of Science of the U.S., founding member and coordinator of the Fiocruz Center for the Study of Workers' Health and Human Ecology, and chaired the Brazilian Society of Toxicology. He participated on several events of the 2030 Agenda on Climate Change, including the United Nations Sustainable Development Summit that adopted the 2030 Agenda in 2015 and the Paris COP15 in 2015 that adopted the Paris Declaration. Welcome, dear Dr. Luis Galvao. You have the floor. Thank you very much, Marisela. It's a pleasure to be once again with in the Andean Health Organization. It's an honor to be with the director-elect, Dr. Jarvasa, my friend and colleague for so many years. We are very proud as Brazilians, and we know that the PAHO is in very good hands, and this is what gives us relief to know that in the future and thinking in the future, we're going to move ahead. This is a task that I received quite complex to comment. Dr. Barbosa speaks so clear and precise about his priorities, which are the priorities that we have. What I prepared some slides to show you what we're doing. So in the implementation of collaboration with PAHO and Dr. Barbosa, in the implementation of this strategy agenda that he has will depend on the collaboration among us. So I have prepared a quick review of the activities in which we've been involved with Theo Cruz and myself. That could be the opportunity for collaboration. So I'm going to share my screen, and my apologies.
Del ritmo, pero me pareció
I think
importante
it's important to mention several of the things that we are developing in our region, and perhaps this will be useful for our colleagues who are participating as triggers to collaborate under the leadership of PAHO and Horas Consul and all the other important initiatives that we have. There are many things that are happening in our region about pandemic lessons, so regional initiative, diplomacy, 2030 agency, science, technology, and innovation, the better surveillance, equity, local production of vaccines, and many things. I will give a small summary. One activity that we participated directly, and Dr. Barbosa was part of this initiative, that was the Lancet Commission, indicate us the major failure in responding to COVID-19 in several ways and for many reasons that led to this unfortunate loss of almost 18 million lives that perhaps could have been avoided, and we could have, if we had better conditions for intervention, transparency, cooperation, etc. And also what Dr. Barbosa already mentioned, all the delay that we had to the SDGs, especially in the core area of health. The vaccination itself is an example of how we went backwards. The Commission also has given us 11 recommendations in 3 key areas of interest: the understanding of what's happening with the pandemic and the origin, that unfortunately it was a quite controversial topic in the Commission. The second is a group of necessary investments to strengthen the health systems, and in line with what Dr. Jarvis mentioned, focus on primary health care, since those events are at local level and the response is always at the primary health. And the approach that mentioned by Dr. Jarvis of to finance for sustainable development, but a development with recovery, green recovery plans, with a more sustainable world, with concerns about the climate. And a large portion of the recommendations were directed to multilateralism, with PAHO, of course, as an institution for coordination, but also establishing a new pandemic agreement and a review of the international sanitary regulation, the reform of global health, the financial support by G20, and also a new global health fund in support to SDG 3. Those were the dreams of the Commission that translated most of the leaderships of public health who actively participated, of 12 working groups and the Commission itself. I had a more direct participation in this working group of global health and diplomacy, and there were several recommendations. I brought some of them. The first one that has to do with the coordination of the multilateral system, where it's stated that we need to provide the United Nations with the necessary resources to have e- an effective performance. We saw that the initial response of the pandemic, the resources have even until today, have the resources have improved, and this is something that we need to be working and asking for more resources for the Pan American Health Organization. We also the empowering of WHO to identify and rapid counteracting the pandemics and strengthening the regional organizations such as ORAS, CONTU, and Health, so they can have adequate compliance with the facilitator role between the world and national systems. PAHO and the sub-regionals of UN and WHO, who know very well the challenges and roadmap and may be more effective in translating this. They also mention the approach from local to the general, but the need to have some over centers effective super oversight. Another the recommendation has to do with regulatory mechanisms. One of the core parts of the after COVID, and to accelerate the evaluation and approval. Also, the intellectual property regime reform. This is an important topic. This morning we had a seminar in this regard, and also the part of exploring options for a better approach to world crisis, thinking in a health world agreement we have for tobacco, for chemistry, for climate change. We could have one for global health. And one idea was a Security Council of the UN for non-military crisis, because the Security Council is deals more with military crisis and not to this other type of crisis. So this that just to see how we are aligned. But I think that the Lancet Commission was able to understand what was happening in the world. So WHO now have this agreement on pandemic. There is a discussion about this intergovernmental negotiating body and also the international health regulation. And we, Fiocruz, with the Sao Paulo University, established this working group, which is contributing to this process, will continue for 2 more years. It was a working group stimulated by the same mechanisms that requested from us many contributions, and we have been working, and I think that's a good collaboration idea, and always hand by hand with the regional group. In addition, there are several initiatives about another critical topic during the pandemic, which is equity. We all witnessed very sadly the great injustice and inequity that we saw in several aspects, from vaccine distribution that was more evident, but many other in vulnerable populations that suffer the most. From the beginning, we sent a letter to the Secretary General, and from there we created this movement of health and equity, and there's others, the other for global health, and the rules of the Americas for equity in health, the network in the Americas that works together with PAHO, promoting the implementation of the recommendations from the PAHO Commission on Equity in the Americas. Another important topic from the pandemic, and there are many activities that are being carried out, and I'm sure are going to be very important in support to Dr. Barbosa's effort, is the part of science, technology, and innovation. This has been critical during the pandemic period, and there are exercises made like this one, a,
un mapa de ruta de
a
investigación
research roadmap from United Nations for COVID-19 recovery,
promocionado por
an
el
exercise
gobierno de Canadá,
promoted by the
donde
government of
participaron
Canada, where
muchísimos
many
colegas
other
de
colleagues
diferentes
participated
partes del
from
mundo
different parts of
y
the
nos
world
da una muy
and
buena
brings
ruta
a very
a
good
lo que es
roadmap for
el, eh, la propuesta de Naciones Unidas
the
para
UN
más acceso a
proposal,
la salud.
which goes
Tenemos
beyond
un
health,
trabajo de investigación para
of
contestar
research
preguntas
and innovation
a
to answer
calendario.
questions that
Pero
were
no solo eso es una
unresponded.
propuesta, pero
It's
también
not
vemos
just a
que
roadmap,
tanto
but
Canadá
also
como Brasil están
in Canada and
participando
Brazil
en
are
una parte
doing the implementation of parts
de esta mapa de ruta.
of this
Otro
roadmap.
tema sobre ciencia,
Another
tecnología,
topic
innovación
on science, technology,
importante es
innovation that is
bueno, los
important
invito a todos
is
los que
this
están en
meeting, and I
Río
invite
el
you
15 de
in
febrero
Rio
del
13 to
2020
15 of next
esta
year, February,
conversación sobre
this
ciencia,
conversation
tecnología,
on science,
innovación.
technology, and
Sé
innovation.
que es una actividad que lo
This is
hacemos
a
junto con
CG
Bélgica,
stick. We do it
donde
with
estamos
Belgium for
pronunciando
some years,
básicamente
where we
en
basically
temas de la
speak
Agenda
on
2030 y
the
los
2030
objetivos
agenda and the
sostenibles con
SDGs
diferentes focos,
with
incluyendo
different approaches,
energía,
including
salud,
climate
educación,
change, health,
energía
education,
y otros
energy,
temas muy
and
relevantes
other relevant
para
topics
hoy. También en
for
el área de
today.
ciencia y tecnología
In this same
hemos
area, we will
colaborado
also
y ha
have
sido muy
collaborated,
interesante
and it's
toda
been quite
la
interesting
conversación con
the
BESA de
discussions
Naciones Unidas
with Conversa
debido
from the
al
US
mecanismo de
in this
facilitación tecnológica
mechanism
que el
of
gobierno
technology
mexicano
facilitation
promovió
mechanisms,
dentro de
including
los
the Science and Technology
innovaciones
Innovation
hemos
Fora,
tenido oportunidad
where
de
we had the
compartir
opportunity as CEO
experiencias
Cruz to
incluso
promote
muy específicas sobre
specific
temas
meetings
de salud.
with respect to health.
Parte de la
And
Comisión
part
Lancet también
of the
está
Lancet
trabajando en la
Commission
transformación y
on
recuperación
transforming recovery
de futuro.
in the
Esta,
future, in a green
este
future.
también fue otro grupo de
It
trabajo
was
que se llama
also an output that we were able to participate and brings several recommendations related to this agenda that Dr. Barbosa mentioned of climate change and other things that are from across sectors. And in this area, but going more into the major challenge that Dr. Jarvas mentioned about the surveillance and identification, the Frio Cruz group and the Bahia group, together with the Federal University of Rio de Janeiro, have developed this proposal of an alert early system of outbreaks with pandemic potential that was developed jointly with PAHO and now with support. We're going to do a concept demonstration and hopefully this could contribute to this aspect mentioned by Dr. Barbosa of early detection to give us time. This proposal, we think we will win 30 days with regards to what we have today in surveillance systems. The vaccine issue, this is an example. Fiocruz, as you know, we first imported the COVID-19 vaccine. This is a classical example of the importance that vaccine had in controlling the pandemic. You can see since we start with vaccination, you see the red curve, how the increase in vaccination, there was a drop in mortality, and this has been undoubtedly one of the major achievements and learnings during this pandemic. And in Fiocruz, we've been working and together from this GISTIC meeting, we're going to have a local production meeting with many colleagues to see how we can continue to move in this agenda. Finally, we we were present in the CSP 30, the Pan American Health Conference. We're more than happy that Dr. Barbosa's presentation, but they also approved 5 important resolutions when we are very interested and excited with this reinitiation of the towards the Sustainable Development Goals with equity through actions on social determinants of health and intersectorial work. There is where you can find all the intersectorial work, this concern of Dr. Barbosa of non-communicable diseases and climate change, and the implementation of this at a global level. I believe that this resolution perhaps is going to be a space for collaboration. It's going to be very important for all of us, very well structured. We have the ministry from Argentina, Dr. Risotti, who was the chairwoman of the executive committee, and they drafted these resolutions, and we are all very encouraged. And finally, I believe that in another area after JSTIC in February in Rio, this new call from this resolution of the UN for the General Assembly, where 193 nations approved the resolution in a consensus of celebrating a summit on health, COVID, in the coming year in 2023. And this is an interesting space for collaboration. So, well, I hope I've given you a summary of what we've been doing, and the people are going to try to make a reality of these excellent proposals that the Dr. Jabra Barbosa, elect director, thank you very much. This is a picture of the Fiocruz with the arms open. This tower of the right, I was working in that area for some time. Thank you very much, and very happy with any questions that you may have. Thank you, Dr. Galvao. We appreciate your intervention, and please stay in this room for the Q&A. Before, we would like to thank all those who are connected from different countries: Argentina, Cuba, Guatemala, Honduras, Mexico, Panama, Paraguay, Chile, Colombia, Ecuador, Peru, Venezuela, Spain, among others. And we would like to take the opportunity to congratulate Dr. Jarbas for your election in the Pan American Sanitary Conference in last September as Pan American Health Organization Director, and to wish you most success in this effort that you will start, and this success will improve the health of the population in the Americas. And we are so happy from this side of the world in South America. And I am sure that this is very important for our region, especially because the Pan American Health Organization is a strategic ally in the work that we do in the Andean Health Organization for almost 51 years in the field of health. Undoubtedly, the pandemic, as in any other situation, as it has been mentioned, put tested the response capacity of the international community with this world spread of infectious disease. And this led to global health in have a priority space in the political and multilateral agenda to coordinate the answer to a threat. This, the importance of health has been seen with development and security with geopolitical consequences like the ones we are seeing. Health has become a global issue, and the factors cannot be approached like we traditionally did it before, because the pandemic has shown that we require collaboration among countries to draft multilateral global strategies. Unfortunately, the Americas became the epicenter of the pandemic, having profound implications, both in the population's health status, the impact on morbidity and mortality, and exposing the weakness of our health systems. We saw that the social and political and economic implications in a region that perhaps have more inequality among countries and inside the countries.
En ese sentido, la
In
pandemia
that
despertó
regard,
algunos
the
de los retos
pandemic became one of the
geopolíticos de
major
los últimos
global
años
challenges for
y
in
nos
recent
presenta
times,
retos estratégicos
and
como la solidaridad, la
we
necesidad de
we
integrar a
needed
los países africanos.
solidarity, multilateral
Una tarea
cooperation, and efforts.
particularmente
All the words
necesaria
that we
para
heard
nuestro
so
país
much in recent
para ser
times
convocado a pensar, a
led
reflexionar
us to
sobre el
think
tema.
and question
En ese contexto es que saludamos
in that
el
context, and that is where we
importante
greet
rol que
and
ejerce
we acknowledge the role
el doctor
that
Harbas
Dr.
liderando la PAHO en
Harbas
estos
leading
próximos 5
the
años.
Pan American Health Organization in the next
La
5 years,
Internacional especializada en salud pública
which is specialized
es la
in
más importante
institution in public health that's the most important in the
como
Americas.
ya lo mencionó, en un
And
escenario
as you
epidemiológico
mentioned,
complejo,
in a complex
con presencia
epidemiological
de
scenario with the
transmisibles,
presence of transmissible
incremento de las enfermedades
diseases, increase of
transmisibles,
non-transmissible
riesgo de
diseases,
brotes,
the
epidemias,
risk of
daños
outbreaks,
causados por
pandemics, and the
accidentes,
damage
violencia,
through
los
violence,
impactos
accidents,
negativos del cambio
the
climático,
impacts of climate
la
change,
transición demográfica
with
y
a
las altas
demographic
desigualdades
transition with
sociales,
great
especialmente,
inequalities
como ya lo mencionó.
between
Esta realidad
countries and
nos
in
está exigiendo
countries.
responder de
And
manera
this
urgente.
demands to
Para ello es
generate an
necesario
adequate
reforzar
response.
la
And for that, we
capacidad del
need
sector
to
salud,
strengthen the capacity of the health
insistir en la
sector
prevención y seguir
by
poniendo la salud en el
persisting
centro de
in
las
putting
políticas
health in the
públicas
center of
developmentales.
policies as an important access for
Concordamos
development.
plenamente
And we
con su
fully
visión,
agree with your vision
que está alineada a nuestro
that is
objetivo común
aligned
con
to
el
our
derecho
common
a
goal
la mayor
or the
calidad de
right
salud
to the
posible
higher level of
a
health,
través de la vida
possible level of
completa,
health
priorizando
through the course of life by
a los
giving
niños, niñas,
priority
adolescentes y
children,
los grupos vulnerables.
adolescents, and vulnerable groups.
Nos place manifestar que
We
desde
are
Horas
pleased
Cono,
to
con la
indicate you that
participación
from
de los miembros
Orascono,
de
with the
los
participation of
representantes
the
de los 6
representative
ministerios
of the 6 member
Bolivia,
countries,
Chile,
ministries
Colombia,
of health,
Ecuador,
Bolivia, Chile,
Perú
Colombia,
y
Ecuador,
Venezuela,
Peru, and
a
Venezuela,
través de los 18
through
comités,
the 18
subcomités
committees,
o
3
grupos de trabajo,
subcommittees,
el
7 working groups,
intersectorial de
the
concertación contra la
intersectorial Andean
desigualdad en salud,
Roundtable to fight
el
against
comité de
inequalities in
coordinación de
health,
salud y el comité
the
técnico de
Technical
coordinación.
Committee of
Vamos a seguir
Coordination.
trabajando
We're
hacia
going to
líneas
continue
estratégicas
working
que
with
estén
the
alineadas
strategic axes that you've
con los fines
mentioned,
comunes a
which
nuestras
are common
prioridades.
to our priorities.
Para la finalización del control de la pandemia, estamos trabajando
To
con
finish the
expertos
pandemic, we are
nacionales
working
en todos
with
los niveles
national
del
and
gobierno
international
a fin
experts at all
de
the levels of the
trabajar de
governments
manera
in order to
articulada
work in a coordinated
y así
manner
preparándonos mucho mejor
and
para la
being better
siguiente
prepared for
emergencia
the
compleja
next
que
crisis or epidemics
se
that
presente
probably will present
respecto, por
ahead.
ejemplo, a la vigilancia, porque
For
sabemos que
example, with terms of
el virus
surveillance,
sigue
we know the
circulando,
virus is
pero
still
estamos
circulating,
trabajando
and we
en
are
un
working
proyecto de vigilancia
in a
genómica
project of genomic surveillance
con 4 países
with
del
4
SADC.
countries of the
Estamos
sub-region.
coordinando
We
pasantías
are
en unos
coordinated
institutos, en otros, para mejorar la
some
capacidad.
training in different
También es
institutions to
importante
increase
seguir
capabilities.
trabajando para
And it's also
cerrar
important to
el
continue
rezago
working to close
no
those
solo de
vaccination
vacunación, sino
gaps,
en la
not
vacunación
only for
regular.
COVID, but on
De
regular
repente algún
routine
comentario que nos
vaccinations
distrajo nuestra
that were
atención.
abandoned when we were distracted by the pandemic.
El organismo andino cuenta con un
The
comité
Andean Health Organization has an
que
immunization
trabaja
committee
para
that
seguir en
works
este campo.
in this field.
También hay un trabajo
There's
conjunto,
also a
no solo con
joint
los países
work,
rígidos,
not
sino
only
con
with
los
the
otros
Andean
países
countries, but with
candidatos. Estamos
17
trabajando
countries.
desde el año
And we are
2017
working since
con el
2017
fortalecimiento
together with PAHO,
del
Washington,
fortalecimiento del
with regard to
laboratorio
strengthening the,
del diagnóstico de tuberculosis, que también ayuda
the
a
laboratory
controlar
diagnosis for
otros
tuberculosis,
virus.
which also helps to control other viruses.
Adicionalmente,
In
para
addition,
fortalecer la coordinación
to
regional,
strengthen
estamos con
regional
la
coordination,
integración regional
this is a regional
de
integration
trabajo
institution
con los
to
6 países
coordinate the effort
en
with the
salud.
6 countries in
Esta
health
pandemia
issues.
nos ha
And
revelado
it is the pandemic that has
hoy más que nunca que
revealed
debemos
us that
responder
there's a
en
great
conjunto, en
need to
bloque,
have a joint
y por
response
eso
as a
nosotros
bloc.
siempre mencionamos que
Therefore, we always
juntos somos más
mention that
fuertes
together
y
we're
que
stronger
podemos
and
más.
together we get further.
Usted ha mencionado
You
la
mentioned
posibilidad de la
the
producción de
possibility
medicinas,
of
vacunas, productos
producing
en este lado de
vaccines, drugs in this
América.
part of the Americas.
Importantísimo tema
This
porque
is a very
hemos
important
sufrido desde
topic
el
because we
inicio
have, during the
el
pandemic,
daño
we
de los equipos de
suffered
protección personal,
with the
los equipos de
PPEs,
diagnóstico
the
quedaban
diagnostic
desusados, quedaban
equipment
en Europa o en
stayed in
Europa
Europe
o en
or
nuestros países
in the north of our
limítrofes
countries and
y
didn't
para
reach us
nuestra, nuestros,
in
nuestro trabajo
our
en este campo.
effort in this
Eh,
field.
valoramos muchísimo y
we value and we
y necesitamos tener
work and we need to
sanitaria
have health
para
sovereignty
no tener esa
so that we
desesperación
don't
de
have that
conseguir o pelearse
uh,
tanto las vacunas,
fight
medicamentos
or
y la asistencia
desperation
sanitaria.
of trying to get vaccines or other technologies.
Doctor
In
Jarvas
that
Díaz
regard,
Cono,
Dr. Jarvas de Horas
con
Cono,
la OPS
together
ha
with
trabajado en
PAHO,
ese sentido.
have been working,
Agradecemos las
and
palabras
we
y
understand by the words that you mentioned
ese
that we will strengthen
trabajo
that
conjunto.
joint effort.
Toda la parte, por ejemplo, de
All
enfermedades no
the part
transmisibles,
of non-transmissible diseases,
obesidad,
we're also developing
obesidad,
obesity,
sobrepeso,
overweight,
y
cancer,
salud mental, que es lo
mental health, which is
importantísimo que queda
very
afuera
important topic
que nos está dejando la
that
pandemia
is that
y
is
de la
we
cual
are
hay
getting
que
through the
no
pandemic,
olvidarnos
and not
de
and also
de
we
nuestros
should not
recursos
forget
humanos en salud, que son
our health human
los que
resources,
en la primera
which
línea
has been always
de
in
defensa
the
son los que realmente
first
han
responders
padecido
and who
más
have suffered the pressure
en
of this
en su salud mental.
situation in their mental health.
No quiero extenderme, doctor,
I
y
would not like
reiteramos
to
el
extend. We
agradecimiento
thank you again
y el deseo y la
and a
voluntad
wish
y el
and
compromiso de seguir trabajando
commitment to
en estos
continue
temas
working
en
in
conjunto.
these topics jointly.
Vamos a aprovechar este
We will
espacio
take this
para
opportunity for this space
hacerle llegar las preguntas, que
to
seguramente han
send.
sido muchísimas.
We have many
Vamos a poder
questions.
responderlas
Hopefully, we
todas.
will be able
Creado
to
una gran
respond.
expectativa
You have created a lot of
participación,
expectation
presencia
with
en
your
este
presence
evento.
and participation in this event.
Empezamos con la
We
primera
will start
pregunta.
with the first question for you, Doctor.
¿Cuál es la importancia de la
What is the
vigilancia
importance
genómica
of
como
genomic
estrategia
surveillance as a new
para el diagnóstico
strategy
precoz de las
for the
epidemias
early
y outbreaks?
diagnosis of pandemic and
¿Hay acuerdos para
outbreaks?
mejorar esta
Do we have
vigilancia a
agreements
corto
to
plazo?
improve this surveillance in the short term?
Gracias, gracias por la pregunta. Es una
Thank you
pregunta
for
muy
your question.
objetiva. La OPS ya está
The Pan American
trabajando
Health
desde el
Organization is working with the countries of the Americas to strengthen the
a
network that we
través
have
de muchos
in this
países que
region
están
with several
participando.
countries who are
Incluso utilizamos recursos
participating, and we
que
use
recibimos de Estados Unidos.
resources
Yo
that
era
we receive from the
supervisor, yo
US
fui director
when I
de
was
la
still
organización.
as deputy
Y
director of the
una de las
organization.
prioridades para la
And one
OPS
of the priorities
de
for the
vigilancia
use
exactamente
of
es
resources
aumentar
was
la capacidad
precisely to
de
strengthen the
surveillance
capacity
genómica.
of genomic surveillance,
Porque el área
because
hoy de vigilancia
when we
epidemiológica
talk
es
about
vital
epidemiological
eh,
surveillance is
no
also
solo
just
para
to
el
speak about
SARS-CoV-2,
genomic, not
no
only for
solo para
SARS-CoV-2,
detectar nuevas
not only to
variantes,
detect new
porque
variants,
eso ya sería
that just because of that, it could
una
be
justificativa muy
a
fuerte, pero mismo
justification,
para
but also
monitorear los
to
virus
monitor
existentes,
viruses that we
virus de
know,
dengue, de chikungunya,
dengue,
¿no?
chikungunya,
Los virus
measles,
de polio, si llega
poliovirus,
por aquí de nuevo.
if it
Es,
comes
es muy
here
importante
again.
porque la
It is very
vigilancia genómica
important
nos
because genomic surveillance
permite
allow
la
us to
identificación
do an
del virus nuevo
identification
y
of the
la
virus
vigilancia de nuevas
and to
variantes.
do a
Por ejemplo,
surveillance of
un
new
virus
types.
que llega,
There
en
is
el
a
caso
case
de
of
esta
measles that
variante que
comes,
está vindo
is a
de Europa
case
o
that
de Asia
came
o de
from
África,
Europe or Asia or
ese es el
Africa.
futuro.
That's the
Para
future,
monitorear nuevos
to
virus,
monitor new
para
viruses
monitorear
and to
los virus que
monitor
ya
the
conocemos,
virus that we already know,
principalmente los virus que pueden
well,
tener cambios.
those
Los virus de
viruses that may
influenza,
change, such as
coronavirus,
the
por ejemplo.
influenza and
Entonces, la vigilancia
coronaviruses.
genómica hoy es
So
parte
genomic
de la
surveillance now is
vigilancia de
part of
laboratorio.
an laboratory
Y
surveillance that's
la
very
OPS
important,
está invirtiendo muy
and
fuertemente
that
en eso
PAHO is
y tiene
investing
fecha
strongly in this. And when
de
I
mandato,
start
1 de
with my
febrero.
mandate on
Entonces,
February
será
1st,
de
is going to be
mi
one of
prioridad de
my
seguir con
priorities
el
to
fortalecimiento
continue
de esta red.
strengthening
Nosotros
this
tenemos, por
area.
ejemplo, la red global
When we look at the global network
que monitorea
that
las
monitored
variantes y
the
subvariantes del
variants
SARS-CoV-2,
and subvariants of
el año pasado la
SARS-CoV-2
participación de América
from the
Latina y
last year,
Caribe
the
creció
participation of Latin America and the Caribbean grew,
enormemente,
but it may grow much
enormemente.
more,
Y para que pueda tener
so we can
panorama
have
adecuado,
an
un
adequate
escenario adecuado de cómo está
scenario
la
of
circulación de
the
las
circulation of the
subvariantes,
different
la vigilancia
subvariants.
genómica es la
The
respuesta.
genomic surveillance is
Y
the
vamos a
best
seguir
option,
invirtiendo en
and
eso.
we will continue to invest in this.
Gracias, doctor.
Thank you, doctor.
¿Existe avances en la
Are there
liberación de
any
las
progress
patentes
in
de
the
vacunas contra la
release of
COVID-19
patents
en los
for
países en los que el
vaccine
suelo físico
for
de acceso
COVID-19
para
vaccine
países de bajos ingresos?
to favor countries with low income?
Ese es un tema que yo creo
This
que
is
debe
something
estar
that
en
I
el
think that
centro
should
del
be
pensamiento
also
de las
in the
instituciones, de
center
los países
of the
por el
discussion,
asunto de
that
las
countries
transiciones
throughout the world
y que
are having, and in the next years it is going to be approved in the World Health Assembly with a new instrument that someone believes there's going to be an agreement or a treaty that Guto Galvao mentioned. The PAHO is supporting the participation of the countries because in this new instrument, we're going to have a definition of topics like this. First, how do we guarantee effective mechanisms to have equity access to vaccines or medications? Second, in the international agreement for intellectual property, for many years, we have the possibility to make intellectual property more flexible due to health reasons. But that is it's not seldom used because there's no detailed definition. Many countries are afraid of using that flexibility that already exists. Some countries have used it, even the US. Remember during the crisis, during the George W. Bush, when we had the crisis of bioterrorism, these letters that had anthrax in their envelopes. President Bush correctly used that flexibility so many manufacturers could prepare vaccines and drugs for that situation. But that was isolated action. I think that this is now in the center of the discussion, how we can use that flexibility in the pandemic situation. And at the same time, we need to strengthen the production capacity because if you say, okay, I'm not one respect a patent, but you don't have production capacity, doesn't make sense. Nothing's going to happen. So it is important to guarantee an agreement in Geneva in the coming year about pandemic situations with the flexibility of this mechanism of intellectual property and also strength production capacity in Latin America and the Caribbean, because then we could take advantage of a process of technology transfer or other processes to have a more decentralized production and to guarantee a better access, more equitable access in our countries. We are PAHO proposing a line of political economy for the transformation of health systems. Could you repeat the question? Is PAHO proposing a political economic line for the transformation of health systems? This is a very important topic. At this moment, we have some countries that are involved in who have started or want to start a strong process of transformation of their health systems. I'm sure I'm going to forget, but we have Mexico, Chile, we have Colombia, we have Bolivia, we have many other countries that have, without radical changes in health, but they want to strengthen primary health care, look for more integration of primary care with specialized health. So I think that all the countries in the region, somehow with different degrees, are looking for the transformation of their health systems. So I think it is important for PAHO to have the capacity of providing technical cooperation to those countries and issue topics of health economic to evaluate the impact that we have to offer in the ministry. How can we move from underfinanced systems that we have today to systems that have adequate financing? We only have 4 countries in the Americas that have 6% of the GDP as public expenditure in health, only 4 countries. And 6% is a value that health economists say that the minimum necessary for the system that can guarantee access and universal access and coverage. I'm sure the countries can increase 4 to 6% in 1 year, but we need to start at some point, and we have to offer for the ministers of economy, for the presidents and the Congress, persons the alternatives that we have. So each increase that they have in public expenditure in health can strengthen primary health care, strengthening the access of people who have limited access. So that's going to benefit in an immediate and direct manner the populations that are the poorest and vulnerable. So I think that PAHO should and must support countries with those alternatives so the health expenditure can be effective, can be expenditure in the best intervention and strategies to improve health of the populations.
Gracias, doctor.
Thank you, Doctor.
De repente recuerda usted, doctor,
Perhaps you remember that
participado
you
en la
participated
reunión
with us in the
de
launching
salud y cambio
of
climático
the Health Andean
el
Plan
20
and
de
Climate
noviembre
Change
del año
in November of
y ahí
2020.
nos dijo
And
usted de
there
manera
you told us, and this is
nuestra coordinadora,
a question from our coordinator,
quisiera hacer un llamado a la acción
I would like to
para
call
que
and
todos nos
make
quedemos
a call for
solamente
action that
en la
let's
meta y
not
que avancemos en
stay
forma
in the
conjunta.
plan, but start
Una
with the
manera de avanzar
execution.
en la ejecución es a
One
través de
way to
proyectos
make progress
multilaterales.
is through
En
multi-country
relación a esto,
projects. In
tengo
that
dos preguntas.
relationship, we have two questions.
¿Tiene algunas sugerencias
Do you
para
have any
agilizar la forma en
suggestions
que se
on
accediera al
agile funds
financiamiento
to
para el
access
desarrollo de
financing
proyectos
for the
multilaterales?
development of multi-country
¿Puede la
projects?
OPS o
And can
MS
PAHO,
impulsar
WHO,
iniciativas
promote
para mejorar el
initiatives or drive
financiamiento,
initiatives
por
to improve
ejemplo,
financing, for example,
redirigir el dinero de países y
redirecting
empresas que más
the
reciben
money
inversión
of countries and
de
companies
terceros y
that
personas
can
que
reach
menos se
to people who
relacionan
suffer
con
loss
los
and
temas
damage
climáticos?
caused by the climate change?
Ese es un tema muy importante
This
y
is a very
urgente,
important
porque yo
topic and
considero
urgent because
el tema de los eventos extremos
these
que
extreme
los casos
events of
de
hurricanes
sequía, de
and
sequía también
drought,
hay,
but there also,
y tiene una carga importante.
and there's an important
Los,
burden with
los riesgos
the
permanentes.
permanent
La
risks.
mayoría de los países de
Most
la
of the
región
countries in
tienen
the
la
region
capacidad de
don't
medir
have the
el
capacity to
impacto de
measure
la
the
polución del aire,
impact
por
of
ejemplo,
air pollution, for
que
example,
produce cientos
that
de miles de
produces
muertes en
hundreds
la
of
región, en
thousands
todos
of
los
deaths in
días.
the region
Al
every
igual
year. The
de la calidad o de la
impact
falta
of
de la
the
calidad de agua
lack
o
of
de falta de
water
acceso. Entonces,
quality or access to
hay
water,
temas, hay una agenda muy
there is
importante
an
que
important
todos tienen
agenda
que ser
that
parte,
health has
tienen
to
que
be
liderar
part and
y al
lead,
mismo tiempo
and at
buscar
the
toda
same
esa
time have
información,
to
porque el sector
make
salud
their
paga
contribution
la
because the
cuenta,
health
como
sector
se
is
dice, paga
at
la
the end
cuenta,
the
¿no?
one who pays the bill.
Las personas que tienen
So
problemas
people who have
pulmonares, de cáncer, de
lung
lo que
or
sea,
cancer or
por la
whatever
emisión
problems
de aire
because of
van
air
a
pollution
sobrecargar el
are
sistema de
going to
salud.
overload the
Entonces
health
yo creo
system.
que sí, salud tiene
So I
que
think that
estar
the
ahí,
health
frente a
sector
las
has to be
conversaciones.
there in the center of the
Nosotros
agenda.
estamos durante esta semana
And during this week,
también en una
we
reunión que es muy
are
importante. Va a
in an
salir
important meeting that is
la COP que está ahí
of the
en Brasil, están
COP
discutiendo temas
that they are
importantes.
discussing
Y creo
important
que
topics.
sí,
I think
con los
that
cambios que hay en la
with the
región,
changes that we have in the
nosotros
region,
puede marchar de una
we
manera
think
mucho
that
más
we can
coordinada.
move in a
Todos
coordinated
los niveles
manner
de presidentes
at
de
another level
gobiernos
of
unidos de la
presidents
región
and
para
prime
que todas
ministers of the
las
region.
Américas
So the
puedan
Americas
tener
region
acuerdos,
can have
pueda tener la movilización de
agreements and the
recursos
mobilization of
para la
resources
protección de
for the
florestas, que es muy
protection,
importante, sin ninguna duda, pero que también se pueda
but it will
abrir
also be
para otros
expanded
impactos
to
ambientales,
other
como
negative
por
impacts
ejemplo
generated by climate change, other the
deforestation.
forest
Entonces yo
and
creo
pollution.
sin duda es
So
importante
I think it is
y
important,
exactamente por eso que subrayo
and it's exactly
la
because I
necesidad de los
underscore
ministerios
the
de
need
salud
of the ministries of health
de valorar esa agenda
to
como una
evaluate this
prioridad
agenda as a priority
no solo
agenda,
del Ministerio de Medio
not from the
Ambiente,
Ministry of
sino
the
también del
Environment
Ministerio de
alone,
Salud.
but also from the Ministry of Health.
Gracias.
Thank you.
¿Cuál es la visión de la OPS con
What
respecto a
is
la
the PAHO's vision
prevención
with regard to the presence
post-COVID
of
que
long
generará y
COVID
generará
and the
mayor
disease burden
desigualdad?
that's going to be and long term?
Que tener más información
We need more
sobre
information
la COVID a largo
about
plazo. Sabemos de
long
que hay
COVID. We know
muchos impactos,
the
los
many
impactos
impacts,
neurológicos, impactos físicos.
neurologic impacts, lung impacts.
Esto va a acrecentar más carga
This
para
is
las
going
sociedades,
to
para los
increase
países.
the burden on the health
Entonces,
systems,
somos
and the
vulnerables
countries are already offering
para
technical
la COVID a largo plazo.
guidelines long COVID, so the health professionals and health services can have the capacity of diagnosing it, accompany, and offer alternatives. In addition to the physical damage, we have mental health effects. There was a great increase in anxiety, depression during pandemic, during the uncertainty in economic and social losses, the loss of people from your family, your neighbors and friends. It was a terrible situation, so we need to look in a wider response. Perhaps I'm sure that COVID to long COVID within the impacts on physical health, but also on the impact on mental health. Thank you, Doctor. Well, there are many questions, but we're closing. I have a couple of questions, and we would like your feedback, Dr. Guto. What would you recommend for this international regulation to control the emergency in public health? There is a working group discussing proposals to change in the international health regulation. Every time that we have a public health emergency that has international impact, it's an opportunity to reform this regulation. This regulation that we have today was possible to progress, and we made a lot of progress with the new regulation because of the SARS pandemic in 2003. The world realized that the old international health regulation that only forced the communication of 5 diseases that could also, based on the official communication of the countries from WHO, that was not sufficient. So we approved this new regulation. Now, any threat, a disease or environmental harm, or can become a public health emergency of international importance. WHO and the Pan American Health Organization, we have a 24 hours, 7 days a week. We check social network, internet, to identify if there are any rumors about outbreaks. And based on that, we now can advise countries. And this is a much better situation than we had before. But the regulations have to become better. For example, in terms of basic capacity, there's a self-evaluation of countries. There many are promoting that we should have an external evaluation that's objective and independent. I don't have anything against that. I think that's good. But at the same time, if we are going to request countries to be more transparent with the evaluation of their basic capacities, we also have to offer the technical and financial resources so countries can do the implementation of the action plans. There's a mechanism that was established with the World Bank. We still don't have all the information, but I'm sure I always like, if you go to see a doctor and the doctor asks you for a CT scan or an MRI, it has 100 pages of results, but doesn't offer you an alternative or a surgery or a drug. Why are we doing so many tests? So I think that this is the way to go. But I don't agree with some proposals. Now let's establish like a global health force in some place, I don't know, Geneva, with 2,000 people that will visit a country when there's a problem. That's not how it works. A new virus is not going to wait for that global force to arrive. If the country where the outbreak starts, and when we look at the most recent one, they were all started in developed countries, in countries where for accelerated urbanization, the lack of adequate health conditions facilitate the contact of people with animals. So if we don't have that capacity to do a early detection and acting early to contain, we may miss the opportunity. So I think that the strengthening and the changes in the international health regulation that are needed to be more transparent, more objectivity, and more capacity of acting have to be well coordinated with this support. So there we can, in a couple of years, all the countries have conditions to respond to a new pandemic. That we don't know when is it going to happen. We don't know what's going to be the severity of the next pandemic, but we know that it's coming. So I think that it is important to be better prepared to what we were for COVID-19.
Gracias.
Thank you.
Bueno,
Well,
finalmente,
finally,
una última pregunta.
last
¿Qué
question.
gobierno le merece la
What
posibilidad
do
de
you think
contar
about the
con acceso
possibility
libre
of
a
transition
datos
to
de
free
salud,
access of health
incluyendo
data,
los datos de los recursos
including
humanos
data
de
of
salud?
human resources for health? I understand that this is country data. Yeah, that is part of an important priority. I think that the pandemic underscored the importance of having quality data. We had ministers in the region that had severe issues, and some ministers had to lose their position because they didn't have the basic information, the how many beds were used in intensive care, how many ventilators in the country, cases and death. That was really surprising, and the need to have better data and the need to do what we call now the digital transformation or revolution in health, to have electronic data. So you go to a primary care, and next, if you go to a hospital, all the data and all the information is available for the physician that's going to be evaluating that person. And also the use of new technologies, which are not that new, such as telemedicine. You can use a cell phone to have to monitor a person with chronic disease or tuberculosis to see if he took the medication every day without having that person to go to to a health facility every day. Now we have telemedicine. The PAHO used funds during the pandemic, and 10 countries in the region, we have a demonstration project to mobilize more resources. And these health centers are connected with telemedicine to hospitals to facilitate access to this specialized care in areas that are more remote areas, rural areas, indigenous population. So I think that that should be part of guaranteeing that the data in each country can be more transparent and available for everyone. If you go to the PAHO webpage and look for health in the Americas, there is a wide set of data that were updated during the conference by country, by sub-region, of many things, even data from the working group in the region. This is an issue, and one of our priorities is to pay the countries so they can map the needs they have, because some countries don't have the physicians and nurses in sufficient amount. Others have the amount, but it's not adequately distributed. Others have, but they are missing some specific professionals, for example, nurses for intensive care or physicians very well trained for primary care. So that mapping is important so we can take use of that initiative that I mentioned, of this initiative of the health curve for the America, so we can value, train, and guarantee that the health workers are trained with their PPE Unfortunately, the mortality rate in Latin American health professionals was double that in the US and Europe during the pandemic because many countries didn't have access to PPE. So with that mapping on the human resources that are required, I believe the first step for mobilization of resources this can be effective, and this is also part of this of having better data, better quality, and that are more transparent to facilitate decision making and monitoring of the efficacy of public health policies in the region.
Una última consulta, doctor.
A final question,
La
Doctor.
participación de la OPS en este
Is
rescate
PAHO
entre
participating in
estornudos
the
de los
fourth
médicos
pillar
en
in
relación con la
the
tos,
health
alimentos
of
y
the America with
medicamentos para
regards of the
rescate de
consortium of academic
500,000
centers for training these
trabajadores, como lo
500,000
hablaba
workers
en la reunión de
that was mentioned
la OPS? Adelante.
in PAHO meeting, please?
Está empezando, né?
This is starting. The US launched the initiative,
invitou a OPS a
invited
coordenar essa
PAHO
região
to coordinate this in the
e eu
region,
acho muito positivo
which
que
I
você
think is quite
mencionou e
positive for
efetivamente
us.
em uma das reuniões que eu
Today,
tive
one of the
lá
meetings
com
I had today
com representantes do
was
governo é
with
exatamente
representatives from the US
porque temos
government
que oferecer
because we need to
alternativas
offer
para que os países da região
alternatives so the
tenham
countries in the
os
region
profissionais
can
necessários.
have the health professionals they need.
Sabemos que sim,
We
profissionais em
know
quantidade,
that
com treinamento
with
necessário,
the
não podemos
necessary,
melhorar
without
qualquer
professionals with the
política
necessary
desse
training, we
tipo.
cannot offer
Então, toda a
the
nossa
health
visão na prevenção, na
services
promoção da
offers
saúde,
in health promotion, in prevention, in care, and the administration of health services, so public health specialists. So there's a significant need. We have some countries that have offered to participate in this initiative, but we are in the process. So yeah, the U.S. had was halted because of the midterm elections the day before yesterday. So now we can mobilize the resources to start. And the idea is exactly to use what already exists, but redirect. For example, a severe problem in the Caribbean countries are nurses. On the same day that the nurses graduate in the Caribbean countries, the companies, the private companies are hiring and signing contracts for those professionals from the UK, the US, and Canada. That generates a terrible problem. Guyana worked with Brazil, that they have a collaboration center with nurses at Ribeirão Preto University. They send people from Guyana to this nursing center to get trained, and a group from Brazil went to Guyana to support the identification and the elaboration of the curricula, so they could strengthen the training capacity. So we do have some capacity in this region. It's completely different to what it was 30, 40 years ago. I think that that's not going to work if we think in having one training center. That doesn't work. If we can identify in Peru, in Colombia, in Chile, Argentina, Brazil, in Guyana, Honduras, Mexico, where there is capacity, and the university that would like to add to this effort, look at the requirement map and make the connection to establish a dialogue platform and to establish adequate financing so those initiatives can go and meet the needs that each country has. I think that's the only way that that can work and to achieve this ambitious goal of training 500,000 health workers.
Gracias, doctor. Y ya para
Thank you.
cerrar,
And to close,
la pandemia nos trajo
the pandemic
la
brought us
telemedicina un poco a
telemedicine
todo, incluso a
even force countries to strengthen
impulsar
or to start.
lo que podían tener. La OPS en adelante va a
PAHO
impulsar esa
is
estrategia
going to
similar a
promote
las
that
de
world strategy on digital
la
health
región de las Américas,
in the region of the
tenemos
Americas
obviamente en la región andina.
Sí, ya
or in
están
the
haciendo
Andean
eso.
region.
Y
Yes, we're working on that, and that was a
eso sí, doctor.
priority when I was
La
a
OPS
deputy
desarrolló
director.
una herramienta
PAHO developed
para
a
evaluar
tool to
a
evaluate
madurez,
the
maturidade dos
maturity
sistemas de informação para a
of
saúde em
the
cada país.
information systems for
O
health in
Banco
each country.
Interamericano de Desarrollo
The IBD
considerou, validou essa herramienta
validated this
como
tool
uma herramienta idônea,
as
porque
a
además de ser um
special
diagnóstico, essa
tool
herramienta
because in addition for a
uma
diagnosis,
hoja de
this
ruta
tool allows the development of a roadmap of how
para sistemas de
strengthening
informação para a saúde.
the health information
Esto
systems.
permitiu que el Banco
This
Interamericano
allowed
de Desarrollo
that the
autorizó
Inter-American
países
Development Bank
que
authorized
habían
countries
utilizado essa
that
herramienta da
had used
OPS
that tool from PAHO
utilizar parte
to use
de los préstamos que
part
tienen
of the loans that
para
they have with
fortalecer
this
os
bank
sistemas
to
de
strengthen
informação para a
the
saúde.
information systems
Esse
for
tipo de
health.
resultado, já desde
This,
os últimos 4 anos,
in the
foi
last 4 years,
nesse.
has allocated $300 million
De préstamos del BID para
of
fortalecer sistemas de
IBD
saúde
loans to
em
strengthen
alguns países
health
que
systems
estão
in several
utilizando
countries
também
that is also being
para
used
fortalecer os
to
sistemas
strengthen
de
the
informação para a
health
saúde.
information
E na
systems.
próxima semana vamos atender
Next
uma
week,
reunião
we're
em
going to
Panamá
celebrate a meeting in
com
Panama
todas as experiências
with all the
exitosas nesse campo e
successful
o Banco
experiences
Mundial
in this field, and the World
está
Bank has
de participar
requested
também. E
to
en la agenda que
they
tiene
want to
el
participate
director
too
de desarrollo
in the
global
agenda. The global health
del Banco
director
Mundial, que
of
es
the World
de
Bank
Colombia, o sea, es
was from
es parte
Colombia, so it's from
de la región,
this
el
region.
ministro Juan Pablo Uribe.
Juan Pablo
La
Uribe,
transformación digital va a
the
entrar como
digital
prioridad.
transformation is going to be a
Todos
priority.
los países lo quieren hacer,
Countries
pero
want
muchas
it,
veces por
but
no tener
many times because they don't
la cooperación, la
have
información,
the
la decisión adecuada,
information and the adequate
son muy
decision,
caras de
makes
software,
very
creen que
expensive
solo
purchases of
comprando
software.
puedes
They
controlar
think that by
y
just
tienen
buying
limitaciones.
software and
Desafortunadamente, en algunos
hardware,
países de la región,
unfortunately we've seen that some countries in the region
que construyen
made
edificios,
investment, they built
compra computadores,
constructed a
mas
building
no,
and
no
bought
sabe
computers, but
começar
the
a
country
trabalhar,
doesn't know
porque
how their mortality
si
is,
no tienen
because if you
una
don't
visión
have
más amplia
a
de
wider
fortalecer
look in
desde ese
strengthening
nivel con los
from the
profesionales de
first
salud, la
level
calidad de los
is
datos que se
the
producen,
quality of the data that's
no va a
generated.
salir nada. No es solamente invertir en
It is
equipo,
not just investing in
computadores
hardware, in
y en
computers,
software. Yo creo que hay
and
que tener
software.
una mirada más amplia
We need to
y
have a
trabajar
wider
juntos
look, and that is one of the priorities that I
para
do
hacerlo,
have
porque es una necesidad
because there's a need
de los países que
of the
que se
countries
puede utilizar
if they can
ese
use that.
mire que la pandemia con toda su
And I think
tragedia y
that the
toda
pandemic,
su
with all
drama,
the
pero también
tragedy and
mostró
drama,
mucho
that
para
it
que el sistema de
underscored
salud algunas brechas
some
que
gaps in the
hay
health
que
system
rellenar y
that
eso
we
hay que
need
hacerlo,
to
no se puede
fill, and that is one.
perder tiempo.
We can't waste any time.
Muchísimas gracias, doctor. Bueno, sí,
Thank you,
muchas
doctor.
preguntas, pero
Well,
ya se nos
we
acabó
have
el
more
tiempo
questions,
y
but this is the
hay
time
muchas
to thank you
preguntas
for the
que
questions.
no alcanzamos a responderlas
We
todas, pero
weren't
sí
able
las
to
tenemos en
respond, but
mente
we always take, consider
para
them
temas de
as
próximos
topics for
seminarios
the
y
next
podremos
seminars, and we
participar en
value
ellos.
your
Para cerrar
participation.
este espacio
To
de
close this
preguntas,
space of
vamos a
Q&A,
pedir a cada uno de
we're going
ustedes,
to ask
por
each
gusto,
one of you, Dr.
nos
Galbao and
compartan
Dr.
un
Barbosa, to give
último
a
mensaje.
final
Empezamos con el
message
doctor
in a couple of
Galbao,
minutes.
si
We
nos puede
start with
recordar
Dr. Luis Augusto
un mensaje
Galbao.
final
Your
y
final
después
message, please, and
continuamos con
then
el doctor.
we finish with
Adelante,
Dr.
doctor
Jarvis.
Galbao.
Bueno, quería primero
Well,
agradecer la
first of all, I would
oportunidad.
like
Bueno,
to
un gusto
thank.
escuchar
It's a
al doctor
pleasure to
Barbosa
hear
con
Dr.
claridad,
Barbosa with the
la
clarity
objetividad que
and
tiene
objectivity that he
de los
has
temas
of
y
all these
también se
topics.
ve
And
muy
also,
claro
it is
su
clear
atención
to
para el
see
proceso,
the
porque sé que el
attention
país
for the
tiene
process
procesos que ya
of
están
strengthening
ya
process that are already
ahí, que tienen
in
problemas,
existence,
tratar de resolverlos,
and try to
buscar
solve their
recursos,
problems and look
y eso
for
nos da
resources. And
satisfacción
that
porque,
gives
como
us
digo, desde
a
mi
lot
lado
of
hay
happiness
muchos
because
procesos en marcha
there are
y
many
procesos que
processes
pueden ser
that are
fortalecidos
ongoing and
y
many that can
procesos
be
que traen
strengthened,
muchísimas
and
cosas. Estamos
many
en una región
experiences.
que tal
We
vez es
are
la más
in a region
con más recursos
with has
y también
most
desafíos más
resources,
en
but it's
divulgar
also that has
a
more
través de sus
inequalities.
muchos recursos.
but there are many resources. So I was very pleased to hear Dr. Barbosa about his vision in relation of how we can strengthen and make progress in those processes. And we at Fiocruz are ready to work, and with you, the Horas CONU. And there's no doubt that there's a lot of work ahead, but I am sure that we're going to achieve a lot. And thank you very much for being here. Thank you. Go ahead, Dr. Barbosa. Well, thank you so much. Giselle, I would like to thank Horas CONU, which is an important partner of PAHO. Thanks to Guto Galbao, Fiocruz has a center that Guto works in that is doing a very important work in strengthening diplomacy in health to train people in every country that can participate more actively in all the global health discussions and regional health discussions. And once again, to thank you for the invitation. And I'm at your disposal for other dialogues and discussions that we can get Horas CONU and PAHO closer and closer, because we have many common agendas, and we can work together in those topics so that countries can make more sustainable progress with a stronger progress to reach better health for all the population, with more equity and with universal access to health, which is so important to have a sustainable development that can benefit everyone. Thank you very much. Thank you very much, Dr. Jarbas and Guto, for sharing your priorities and plans for PAHO in the next 5 years. We coincide in many, in all of them, I believe, and we live happy because we're strengthening this effort that we've been developing, and we will continue to work with you to reach our vision as Horas CONU, that is to make significant progress in the effective exercise of the right of health of the population through progressive integration and intensified network of cooperation, and harmonizing and coordinating and implementing decisions, political public plans and projects, experience exchange and technical cooperation in order to fight the inequalities in health. Once again, thank you so much for sharing with us. Very happy for this activity, and I'm sure that we will continue working, as you mentioned, in all the topics that we've been able to share today. Our thanks to all the participants and the Horas CONU team who make this event possible, thanks to their commitment of Andean and Latin American integration. And would like to invite you to webinar 151 next Tuesday at 5 p.m. Peruvian time on the World Infancy Day. We look at the rights of children and adolescents from their own voices. Thank you very much to everyone, and see you soon. Good evening.
Gracias. Hasta luego.